Okay, you guys ready to get started? It's 2 o'clock. Okay, so before we get started with our first seminar of this semester, just note that this seminar is being recorded. And it's my pleasure to invite everybody to the Fall 2025 seminar series for our School of Public and Community Health Sciences. As it has been for the last 5 years or so, we are co-hosting this seminar series this semester with Missoula Public Health through our academic health department arrangement with Missoula Public Health. And before I introduce our speakers for today, just a plug for next week, we have Bernard Cominco, and he will be talking about improving access to medications, challenges, and opportunities for communities. So he's a PhD candidate, and this will be his informational seminar. So for today, we're super happy and lucky to have some folks from our state health department, Montana Department of Public Health and Human Services. And on tap for us today are three speakers, not just one speaker, but we have three speakers. We have Melissa Dell, Tessa Bailey, and Kyla Rock. So Melissa is currently at the State Health Department. She's dedicated nearly 2 decades to public health. She is currently the program manager for the Montana Arthritis and Falls Prevention Programs at the Department of at State Health Department. Melissa holds a Bachelor of Science in Community Health Education from Montana State and a Master of Public Health from Walden University. So Tessa is a registered dietitian with over 20 years experience in public health nutrition. After earning her Bachelor of Science in Food and Nutrition from Montana State, she began her career working in WIC and school nutrition, and she now serves as the interim Bureau Chief and Nutrition Program Manager for the Aging Services Bureau at DPHHS. And Kyla Rock has been with the State Health Department for 10 years and with Alzheimer's and Dementia program for a year and a half. She has an undergraduate degree in general studies with emphasis in gerontology from the University of Nevada, Reno, and a master's degree in social work from Arizona State University. And throughout her career, Kyla has been able to work with families across the lifespan and in various capacities. So today, they're going to talk about aging, falls prevention, and Alzheimer's. So I'll turn it over to you guys.
Great. Hello, everyone. My name is Tessa Bailey, and I am the Interim Bureau Chief and Nutrition Programs Manager for the Aging Services Bureau, and I'm going to start off today. So our agenda, as Tony said, we'll go over some aging issues, Alzheimer's and dementia, and falls prevention. So a little snapshot of aging. Currently, Montana ranks 6 in percentage for population of 65 and older. And by 2030, over 30% of Montana's population is projected to be over 60. So we have a very high percentage of older adults in Montana. And if you are from here, you probably understand that. The rate of increase is not really uniform, though, across the state. Our rural counties definitely express a higher need and a higher cause of this versus some of our western cities, more of like Missoula, Bozeman. Those aren't technically appear to be aging near as fast as our eastern Montana or north central Montana areas, where it's a very rural area. And you can see a little map over here from the Census Bureau of just kind of where we are in relation to the other states, but we're a really high percentage of people 60 to 65 and older, or older adults as we call them. So we don't really like the term seniors or elderly. We prefer the term older adults. So I work, as I stated, the Aging Services Bureau, which is under the Senior and Long-Term Care Division for DPHHS. So within this division, there are 3 bureaus. There's the Aging Service Bureau, which I'm a part of, which we all also are called the State Unit on Aging. And we oversee the grants and fundings for the older adults and caregivers grants. Mostly, most importantly, the Older Americans Act is the biggest one that we oversee, which I'll get into. We also have Adult Protective Services, which is our specialist to work to protect our most vulnerable adults from abuse and neglect. And then we have our Community Services Bureau, and they are more Medicaid eligible Montanans. So through the Big Sky Waiver Program, our Community First Choice Program, Home Health Hospice, and a really big one also is Money Follows the Person. So those are the three bureaus that provide services under the Senior and Long-Term Care Division at DPHHS. So the biggest one and the biggest programs that we see in the Aging Services Bureau and that we oversee the funding and all the regulations for is the Older Americans Act. And this act was started in 1965. It is a federal law. It is a law that's wrote in, and it is similar. It gets re-upped every 5 years. That it goes through a reauthorization process. And so it goes through a national network of services and providers for older adults. And it's really for them helping older adults live more independently and with dignity in their homes and communities. So really trying to get them to stay in their homes as long as possible, but also making sure they're healthy doing it. Some of the key services that and programs that we undersee under the OAA, nutrition programs are our biggest and our biggest funding source, and those are the congregate and home delivered meals. The congregate meals, most commonly people understand, are the meals at senior centers, but they can be a variety of other meals too. Some are in some community-based organizations, some are in some assisted living. They have different regulations for that, but most people understand them as senior center meals. And then our home delivered meals, and most people understand those as Meals on Wheels. And so Meals on Wheels is actually an organization. So Home Delivered Meals is what we provide the funding for, but they're the same in all aspects of it. The funding and everything goes for the same. But those are the two most notable names for both of those, and that's the biggest funding source that we have for Older Americans Act. Then we have different supportive services. They include transportation help, information and assistance, home and assistance, and those range from homemaker services, personal care services. So anywhere from people coming in to help clean the home to help doing grocery shopping and other small chores and things. We have senior center activities, senior companion program, or our friendly visiting program, which is people can call on the phone or go over and visit with seniors to keep them not so isolated. Skilled nursing, community education outreach, and assistive technology. And assistive technology can be a variety of things from home repair and modification to special devices that help them stay in the home, whether that be adaptability resources such as stuff for like eyeglasses to anything to doorbells and different sensors for them to live safely in their homes. We provide caregiver support such as respite, counseling for caregivers, information and assistance. Caregiving is a real big push in Montana right now, caregiving support. We have so many caregivers and not a lot of resources for them. So respite is high on our list. We also do evidence-based health promotions, and this falls under Melissa's wheelhouse with falls prevention. But we also have T-Care, which is a caregiver kind of a respite. It's an app that allows, it's a nationwide app, but allows caregivers to ask questions, get information and assistance that way as well. And then there's the diabetes prevention programs as well. We also in-house a legal service developer program. And we have a legal service developer. We contract with an attorney as well as a paralegal, and they expand the legal assistance for our older adults. The biggest things that they do for our program, or the most things that they talk with older adults about, is estate planning, wills, transfer on death deeds, that types of things, powers of attorneys. Those are the biggest things that they see and that they deal with on a daily basis. And they also do provide some clinics around the state every year. They're actually out in Sydney on the east side of the state right now, providing a clinic where people can come and actually get all that documentation right. Like they have appointments and they can come, our attorneys are there and everything, and they can get all that information taken care of for free if they're 60 and older. And we have our long-term care ombudsman program. And that really is such an important program, and it addresses the complaints. It really advocates for the rights of residents in long-term care and assisted livings facilities. And so they're really the voice for the most vulnerable in our population. So a very important program. A few of the other grants and programs that we oversee is the State Health Insurance Assistant Program, which is SHIP in our world. And this provides assistance to Medicare beneficiaries. And really what that is, especially as open enrollment is coming, and that starts for Medicare for Part D, where they can change their plans for their Part D plans, which is their prescription drug plans. That starts on October 15th through December 7th, and that is really the only time that Medicare beneficiaries can change their plans. There's a few circumstances where that's not true, but for the most part, that's when they can change their supplemental plan, anything like that. And the SHIP counselors around the state help our older adults, figure out what's the best plan for them. If there's premiums and, trying to find the best plan that covers all their prescription and all their needs for the lowest cost out there. And then we have our lifespan respite program, and this goes back to caregiving, but this is a separate grant. And we do provide temporary breaks, the respite really for caregivers of children, adults, and older adults with special need. And again, this brings back such a big need in our state with there's so many caregivers out there that caregiver burnout is a huge issue in our state. So really trying to find ways to alleviate that. So to be eligible for any of these older Americans Act programs, really all it is an individual needs to be 60 or older, or they can be a spouse of any person that's 60 and over, especially on the meal programs, or a person with disability who lives with an adult age 60 and over. So it's a lot of time it's parents caregiving for their children, their adult children, and they can get provided meals and some of the other services available as well, especially respite and things like that. But really, as long as you're 60 and over, people qualify. We do ask for voluntary contributions for services, especially our meals and transportation services, but no one is obligated to donate to any of that. It's just a suggestion based on the federal funds and the state funds don't support all of it, so it helps our programs in our areas keep running. But again, there's no requirement that people have to pay for these services. Within the Older Americans Act and how Montana is set up is the state oversees the funding and the regulations, but there are 9 area agencies on aging around our state that actually either perform the services themselves directly or they contract out, we'll say senior centers or other health organizations to ensure the coverage of these programs. So we have the 9. There is a map there of how our 9 are broken out. And these 7 tribal reservations are also included within these counties and are overseen. So as you can see, the east and north side, they include quite a few counties, a lot of land that they're covering over there when they go. But these are a vital in part of providing services to our older adults all through Montana. So yeah. And not every year, excuse me, every 4 years, the state has to do a new area or state plan to the federal government, explaining kind of our needs of Montana, how we're going to try to address them for the next 4 years. But then in turn, the areas need to supply that to us with their area plan. So we're always constantly looking at how things are changing in their area and how they can adapt. The last thing I'll go over, that's a fun one that I also oversee, is the Senior Farmers Market program. And so we oversee that program for Montana. It's online or on trend and on the same standpoint as the WIC Farmers Market program. They're ultimately mostly the same, just serving 2 different populations. How we do is we actually contract with Farm Connect Montana out of Missoula, and they run the program for us. But this really provides our low-income seniors with coupons every summer to go to their local farmers market and purchase locally grown foods. The vouchers are $48 per person. This one's a little different than the rest of our program. Our other programs with the Older Americans Act are federally funded through HHS, through the Health and Human Services Department federally, but this program is under the USDA. And this is an income-based program. You do have to qualify be low income to qualify for this program. But we run a pretty successful program here with Farm Connect, and they do a great job for us. And our seniors always look forward to their coupons every year to go to their local farmers market. So that is what I have for my section today. Oh, it looks like I'm next. So now we're going to talk a little bit about Alzheimer's and dementia. You can go ahead and advance. Thanks, Tessa. She got volunteered since she was first to run the slideshow. Lucky duck. Thank you. So first, just to go over a few numbers, and this kind of reflects some of the things that Tessa just talked about. And I love that map that she showed from the Census Bureau. So thanks for having that in there. But like she said, our state is in the top 6 of the oldest states in the country and the quickest aging. And so what comes with that is obviously increased numbers in Alzheimer's and dementia. And just to clarify before I jump into this any further, dementia is not a normal part of aging. That's a big myth that's out there. I tell people about, I was actually in Missoula a few months ago at a resource fair at the Springs, and a lot of people that were walking through were residents, and there was a couple folks that came by the table and they were like, "Oh, I'm headed there. I'm just getting older every day." And I was like, "Whoa, whoa, whoa. That's not that's not true. There's things you can do." And so really what we're trying to do, and it's kind of a more recent thing that Alzheimer's and dementia has become really a public health epidemic. And so something that we really need to address and look at trying to slow some of these numbers that we're seeing by implementing some healthy lifestyle habits. And I'm going to talk about a study that was recently done here in just a little bit that showed the benefits of being able to implement some of those things to help reduce the risk and hopefully impact um, some of these numbers that we're slated to see over the next few years. So nationally, I just kind of wanted to give you an idea what we're seeing throughout the country. There's over 7 million people currently with Alzheimer's disease, and it's believed that about 200,000 are experiencing younger onset dementia. And then about 12 million people are providing unpaid care. And I'm sure there's many of you on this call today that if you haven't experienced this, you've got a family member, a friend, somebody who is experiencing caring for a loved one with some sort of a form of dementia. It's incredibly common that folks are doing this and they're unpaid. It's really difficult for individuals that are experiencing that younger onset dementia because it can impact it usually, and when they talk about younger onset, it's about 45 to 65 age range is what they're kind of looking at. And those are really prime earning years. And so that can really impact families in a negative way when people have to leave the workforce. It can be really burdensome financially. So that unpaid care that is being provided is slated at nationally to be about $413 billion, which is a pretty insane number. It's kind of wild to think about that. So in Montana specifically, and these are all facts and figures. Every year, the Alzheimer's Association puts out some facts and figures nationally, but then they also go down state by state and look at each state's numbers. And this number of 21,000 people living with Alzheimer's disease, my guess is that's probably low. I think that number is actually from 2021, and it is the one that is continuing to be published. So I'm really wondering if we need to update that, the way that we're getting that information, because I would venture to guess there's more people in Montana that are experiencing that disease. And then with that, in general, if you've ever been to a presentation from a representative or volunteer with the Alzheimer's Association, they often talk about when they're looking at people who are providing care, it often is 2 people for every 1 person living with the disease. And so that number of 17,000 that are providing care in Montana, it's highly likely that is also higher. Often people in Montana don't necessarily identify themselves as caregivers. It's just it's what you do, right? I mean, Montanans show up. And so I think there's a lot of people that just don't even identify themselves that way because it's just what you do for people you love, whether it's a neighbor or family member, whoever it may be. And again, in Montana, that's valued at about $578 million, which is, again is a pretty large number. The other thing that can impact caregivers, and like Tessa was talking about, the lifespan respite grant, which is a really amazing resource to have. A lot of caregivers experience pretty high rates of depression. And they're in the most recent facts and figures that the association put out, 22.8% report that are actually going to report it are experiencing depression again. My guess is that's higher than than that number that we're seeing there. So that's just kind of an idea of what it looks like nationally and then what it looks like in Montana. So next slide, please. So money, what does that look like as far as money goes? Um, the other piece of that is emergency department visits, unnecessary hospitalization that can happen. And they are in the most recent facts and figures. They're saying that there's an estimated 2,900 visits that occurred, excuse me, for individuals that are living with dementia. And one of the reasons we're looking at that is because if we can provide those that are giving care to people living with the disease, if we can provide them some education, some tools, and things like that to help prevent some of these instances that are occurring that lead to folks going to the emergency department, maybe we can bring these numbers down. And we know how expensive emergency department visits are. They're one of the priciest things you can do. And so we really want to do what we can to get those numbers down. Annually, and I believe these numbers are from CMS, which is the federal agency that oversees Medicare, Medicaid. But what they're looking at is for someone with dementia, it can cost just about $45,000 every year to care for them. And they're comparing that to $15,000 for somebody who does not have the disease. And again, for many of you, maybe that you've seen grandparents, aunts and uncles, neighbors, whoever may be experiencing the disease, it can get to a point in the later stages where it can be really hard to keep somebody at home because it's just not safe for anybody. And so those care facilities, it's about, I looked up one or two actually in the Missoula area, and they were about $4,000 a month, which is pretty steep. I know that is nowhere near what I pay for rent. But again, you're looking at some specialized care that's required with some specialized training and things like that. So it's extremely financially burdensome and difficult to manage when somebody does develop any sort of dementia. Next slide. So why is dementia in public health? And like I said, this is from what I've read and looked at, and there's probably some other people who have better information than I do on this, but it looks like I would say within the last maybe 10 to 20 years, they've really started looking at this through a public health lens and how do we impact. Again, they're slating that we're going to see upwards of, I think, 11 or 12 million people within the next few years that are going to be living with the disease. And so how do we decrease those numbers? And so what they've done is with the grant that I oversee, which is called the BOLD grant, and I'll talk about it in just a second. But one of the things that was created is the CDC, in partnership with the Alzheimer's Association, created the Healthy Brain Initiative. And that was actually the first one of the HBIs that was published was in 2007. And that was really to help promote cognitive health or brain health and recognizing that this really is a public health issue. I remember in the late 90s, early 2000s when I was going through CNA training, I remember them talking about the baby boomers and the drastic numbers that we're going to be seeing of folks aging down the road. And so again, the fact we need to be doing so much more to care for and support these aging populations because we are in the midst of that silver tsunami. It's happening. And so again, these things were put together in order to help with that. The HBI really is a roadmap, and it's got some different activities and action items that, whether it's county, state, city, whoever maybe addressing this issue, local health departments, some ideas of efforts and actions you can take in order to move things in the direction that we need with greater public programming, better support and policy, state funding, community efforts, all those sorts of things to help support families and people living with dementia. So the grant that I oversee is called the BOLD grant, and it is under the Building Our Largest Dementia Infrastructure for Alzheimer's Act, which was passed in 2018. And it funds 43 states and other jurisdictions. And the areas that we are looking at are promoting brain health, early diagnosis and treatment, increasing community clinical linkages, and then, of course, caregiver support. So like I say, one of the reasons this is housed within public health is to encourage and promote healthy lifestyle habits that's going to support your brain. Many people have heard about heart health and cardiac health for years, and not as many people have heard the phrase brain health or cognitive health. And so really what we're trying to support is just saying, hey, look, what's good for your heart is good for your head. And so the messages that we've been given for staying heart healthy throughout our lives, the same thing is true when you're trying to support your cognitive health. And so implementing those things is super important. I found it super interesting. Our local hospital here in Helena, St. Peter's, they've in the they've got commercials going on during the morning news, and they've got this wellness clinic, and a new cardiologist to Helena does a little commercial and talks about heart health. And she says that when you implement these healthy lifestyle habits, you can decrease your risk of a cardiac event by 80%, which is a really big number. For dementia, if you implement some of those very same strategies, you can decrease your risk of dementia by 40%. So when you're looking at those percentages and implementing those healthy lifestyle habits, again, what's good for your heart is good for your brain. And those are pretty significant numbers. And so specifically with dementia, even if you have a genetic component, family history, one of the genes they've identified, even when you implement these strategies, that percentage remains true, that you can decrease by about 40%, which is, again, pretty encouraging. Next slide, please. So the last thing I wanted to touch on was just let you know about this US pointer study that was just completed. And this was really exciting because this is really the first of its kind studies that shows some really data-driven evidence of how these lifestyle habits can really improve cognition, not just help prevent and maintain your brain function, but to improve it. And so what they did, it was a 2-year clinical trial. They targeted the risk factors like physical activity, a healthy brain diet, cognitive and social engagement, and then health monitoring. So they had 2 different tracks that people did. One group did a structured health coaching track, and the other did the self-guided program. And they found improvements for both groups. They did find there was greater improvements with the structured health coaching, but both groups did improve their cognitive functioning, which is pretty amazing. And so this was kind of the recipe that they determined were the best actions and habits to participate in. So there's a computer-based, and I don't know, again, this is all fairly new and recent. They just presented at the annual science conference that the Alzheimer's Association puts on every year. And so there's going to be a lot of other sort of dissecting of this information, and what does this look like and how is this going to be applied that's coming. So I don't know. One of the things they recommend is this computer-based brain training program. And I don't know if that's going to be something that's made available for folks through the Alzheimer's Association. My assumption is that will be the case, but I don't know that for sure. But the other thing they talk about is nutrition, specifically the MIND diet. And really, it's about making sure that you're adding berries, dark leafy greens, nuts, whole grains, olive oil, fish, that kind of thing to your diet. And then health monitoring, making sure that you're getting regular check-ins related to blood pressure, weight, and some other labs. And then 30 to 35 minutes of moderate to intense aerobic activity at least 4 times a week. And so by implementing all of those pieces, they saw some pretty significant improvements for folks' cognitive health. Um, Again, super exciting. They did a study like this in, I believe it was Finland, which was the finger study, and so they really tried to duplicate that research and those results here in the U.S. And they did find that it did remain true to the results that we're seeing over there too. So that's just kind of an overall picture of what's happening right now in the world of dementia. As far as Montana goes, with some of those areas that we highlighted as far as promoting things like brain health, early detection diagnosis. One of the things with the grant is the first year or two really focuses on a coalition, and Montana already had one. But what we decided to do was to create a steering committee specific to the grant so that we could report on the things that the grant requires. And so a state plan was written. Again, the prior coalition had actually already written that, which was kind of amazing. So we just kind of tightened it up a little bit and then got that approved through CDC. And we are now working on meeting the goals that were outlined in that plan, which are around those areas that I had mentioned before. So we're looking at making sure we've got resources available for folks, access to education, access to providers who are knowledgeable about dementia and what that looks like and how to diagnose, and making sure that folks are comfortable having those conversations. So there's a lot of things that we're doing, and I see a couple familiar names on here who are helping with that work. So thank you so much. But yeah, so that's where we're at with dementia. Melissa.
All right. As you can see, my name is Melissa Dale, and I'm the program manager for the Falls Prevention Program at the State Health Department. And I was going to say, this is very timely to have this conversation with you guys today because National Falls Prevention Awareness Week is actually coming up, which is going to be September 22nd through the 26th, which so happens to land on the first week of fall. So you can remember fall and fall there. So our goal is to provide education on falls prevention because we want to prevent people from that first fall and then make sure that they're staying healthy. So next slide. So I just wanted to give you guys some stats really quick about falls and what we're seeing. Around, especially in Montana, but falling is the leading cause of unintentional injuries and death, both nationally and in Montana. Uh, Nationally, we are seeing about 1 in 4 older adults fall each year. Unfortunately, in Montana, we are seeing this as a higher rate. So it's nearly 1 in 3 older adults are falling each year. And this goes back to that map that Tessa was showing us, how we are higher rates of, we have a higher population of older adults. I've heard we're the grayest state in the West. So that kind of brings to that. There also, we're kind of in rural areas, so that also increases our risk for falling here in Montana. So we definitely want to reverse this as much as we can. So next slide. So as far as those who are at risk for falling, so this is information from Montana. Really, anyone is at risk at falling. However, there are people who are at higher risk for falling than others. So we're seeing older adults, as adults 55 and older, who we have higher risk of falling. And I do want to know that falling is not a normal part of part of aging, which Kyla mentioned, like Alzheimer's and dementia is not a normal part of aging. So we might think these things like, oh, you hear about it so much, but it's not a normal part of aging. It's just with the falls, the reason we see it higher in older adults is because our bodies are changing. We're starting to lose the muscle mass, and having weaker balance. And so there are things that you can do to reverse that, which we'll talk about in a little bit. Um, we also are seeing people who have a disability are more likely to fall. Individuals who have a chronic health condition are more likely to fall. So just kind of show you how vicious this cycle can be. Um, a chronic health condition could be arthritis, and arthritis is the number one cause of disability. So you can see how this can be kind of a vicious cycle. And then, like I mentioned, living in rural areas is actually a risk factor for falling. We actually don't have exact reason why people in rural areas are falling, but I've heard anywhere from the lack of infrastructure, so no sidewalks, to somebody telling me, well, there's nothing to do in small towns except for go to bars. So that might be the reason they're falling. But regardless, those are the risk factors that we are seeing here in Montana. I want to note that men and women are equally likely to fall. So it's a 50-50 chance, whether it's a man or a woman who's going to fall. However, women are more likely to be injured if they do fall. This is due to our body makeup. We have wider hips, but then we're more likely to have osteoporosis, falling there. So that can cause a broken bone. Next slide. I always like to share this. I know it's kind of a little bit dated, pie graph here. It's from 2017, but I have to admit, when I first started into the falls prevention world, really kind of just thought people were falling off ladders. Like, I don't know what I was thinking, but that really only counts for 7% of falls in Montana. The big part, that big dark blue part there, that's 57%. This is what we call a same level fall. So this is from people who are either slipping, tripping, or stumbling. So they're just walking along and then just something happens in their gait and then they end up slipping, tripping, or stumbling. So I always feel like that's very worthwhile to note. Maybe that's just because it was, like I said, I always thought people were just falling off ladders. But I just wanted to let you guys know that. And this is part of that, like we talked about the aging process of, your body's changing. And so you're more likely to see that shuffle or stumble. So we do have classes that we can get people to take to help improve their gait and their balance and all that. So next slide. I just want to reiterate that falling is not a normal part of aging. I mentioned that, but I feel like that's a huge thing to note. And then next slide. So, um, I guess I have been telling you like, oh, all of the risk factors and all the data, and I could tell you until I'm blue in the face and like why these are all big issues. But having risk factors actually, if knowing your risk factors is going to help you be able to mitigate having falls. And what we usually see is usually it's multiple risk factors that is causing somebody to fall. And so typically what we hear is somebody, you know, they weren't paying attention. They were going down the stairs. They had a basket of laundry. The cat came up and tripped them under their feet. So there you can see there's like 3 or 4 risk factors going on. So they have multiple risk factors happening. And so we typically see it's not just one thing that happens, but there's just a lot of things that are going on when people fall. But when you can mitigate some of these risk factors, it can mitigate your falls. So next slide. I wanted to promote the National Council on Aging has a falls free checkup. This is a free falls risk assessment that anyone can take. So I want, especially with in lieu of National Falls Prevention Awareness Week coming up, I would love to have you guys share this either with your friends, your family, or just within your community. Um, this is, like I said, it's free, it's quick, and it's anonymous. So it's 13 yes and no questions that somebody can fill out to learn what their risk factors are. So it'll tell a person if they're at risk for falling. And surprisingly, it's only if you have 4 or more risk factors, you're at risk for falling. So it's very little to have be at risk for falling as far as different risk factors. And then with this National Council on Aging Falls free checkup, it will also provide information of what your risk factors were and then what things you can do to help reduce those risk factors. Like I said, it's anonymous, so somebody can take this and they don't even have to put their information anywhere. However, at the end, if somebody wants, they can provide their email to learn more information about um, falls and fall prevention, um, and help to make sure that they stay on their feet. I actually did this, I want to say back in 2020, and they only sent me like 10 or not 10, I'm 4 emails after I completed the full assessment. And then they never sent me anything again. So I just wanted to let you guys know that so people don't feel like, oh, once my name's out there, I'm going to get spammed and everything. So they have the National Council on Aging. They just want you to know what your risks are and want you to learn, and they're not going to harass you after that. Next slide. So just some things about preventing falls. Go ahead and next slide. Just to talk about some falls prevention, just because I wanted to not be so doom and gloom. But the number one thing people can do to prevent falls is to be physically active. That's the number one thing. Kyla was just talking about this. What's good for your health is good for your brain. And this is good for your body too. We actually have just found that people who have regularly exercised, this is older adults, within the last 30 days actually reduced their chance of falling by 26%, which is huge. That's amazing numbers there. So that's the number one thing people can do to be prevent falls. Go ahead, next slide. Other things to do, just going to quickly go over, but having annual hearing and a vision exam, reviewing your medication with your doctor or pharmacist annually, and then also checking your environment, making sure you're removing any hazards. So we have on our website a variety of home checklists if you ever want to go and look at that. And then next slide. So I did mention the falls prevention program. We do support several evidence-based programs. So it comes back to what Tessa was mentioning, that the AAAs need to support, and we support those evidence-based programs. We have several of them that are focused just for fall prevention. The first one's called Stay Active and Independent for Life, which is SAIL. This is an exercise program with a little bit of education. It is an exercise program that's designed specifically for older adults. We also have another one called Stepping On. This is an educational workshop. So this is mainly, it's a little mostly education with a little bit of exercise. And then lastly, we have Tai Chi for arthritis and falls prevention, which we have just brought in last year. And so we're building that across the state. And interestingly enough, Kyla and I have found a lot of research talking about how Tai Chi actually helps improve your cognitive function. So you can just see how this is all being tied together here. So go ahead, next slide. I just wanted to let you know with all of these classes, you can actually find all these classes on the Chronic Disease Bureau website of our community-based programs. I actually just put a link in the chat, but there's also the link down there too. So if you're ever looking for these classes, please just go on here and have that. We will actually be having several trainings next spring. So if anybody's interested, you can reach out to, well, any of us, and they'll guide you to the registration. So next slide. That brings us to any questions. I'll let Tony kind of take over here.
Yeah, thank you for the presentation. That was really informative, and it's great to hear about all the services that you guys are doing. As far as questions, if because there's a lot of us on the call, if you have a question, just raise your hand and I will call on you. Or you can copy and paste or just post a question in the chat, and I'll be sure and get your question raised. So, any questions from the audience? And if you want to stop sharing your screen, we can kind of see everybody from your end. I guess I had one question just to get us started. So can you talk a little bit about the services that you provide in rural communities versus like some of the bigger cities, Missoula, Helena, Billings? How do you how do you make sure that they get the same services in the rural underserved communities versus the more resource communities?
Well, for the Older Americans Act programs and the services that we do at Aging Services Bureau, there's a big difference between that. Obviously, one of our biggest things in Montana, and I would say this affects most of our giant western states, transportation. Is one of our biggest things, especially in the rural area. We just don't have the population to support Ubers or taxis or anything like that. There's just not, or like a community bus service. There's just not the population to support that. So, we do, some of the communities and counties in the state offer that service through the county. They have a van and they pick people up and drive them to appointments and around, and it does get challenging, as I am from the east side of the state, from one of those very tiny towns, and it is challenging because none of the doctor's appointments are in the town. They are 30 to 60 miles away usually, or all the way to Billings, which is 3.5 hours away. So there's a lot of coordination between the areas, sometimes to get transportation services between areas. But yes, now they're supposed to cover a lot of these areas. Can everything be covered in all parts of Montana? No, because again, the population doesn't allow for some of that to happen. We do the best we can with the funding that we also have available. We are, in the federal government's eyes, a minimally funded state, so we don't even get the normal percentage amount of federal funding. And there's about 11 states in all of us little tiny populated states. Wyoming is also one, North Dakota. So we're all, all of us little states over here. But so yes, our AAAs and our other centers and other service providers do definitely the best they can with the funding that they have available. But really in our rural areas, a lot of times the counties are picking up a lot of the slack of funding for that and providing that assistance.
Thank you, Tessa. Any other questions? I have another question, and it relates to funding. I know public health is losing a lot of funding these days. How are your programs focused on older adults? How are they holding up at this point?
It's been scary. Um, I guess for myself, for the falls prevention, so we actually don't have any funding coming through right now. So we're being creative and we're working. So our arthritis program actually supports several of these. So like the SAIL and the Tai Chi for arthritis program. So we're kind of just trying to be creative and work with other programs and partner in ways we can. Um, that's that's been my workaround. I don't know about Kyla or Tessa.
Yeah, we still haven't. I'm not sure what it's going to look like next year. Bold is a 5-year grant. However, it's the annual award, and so we're heading into year 3, which is our implementation phase. So we don't have quite the same kind of programming and things like that Tessa and Melissa have been talking about. We're hopefully going to get there, and so I also wanted to just jump in real quick about the rural area. I know all of us up at the state level make concerted efforts to make sure that we're reaching out to those rural communities and have some of those conversations for how we could support them and what it may look like. Um, and again, sometimes there are just barriers there, like Tessa was talking about. But I will say we have not yet gotten our award letter. From what I understand with the budget, there's a lot of support for Alzheimer's and dementia work federally, which is really great. The latest I've heard from a recent meeting by David, thanks. Um, a recent meeting we had with some counterparts, it sounds like the most recent discussions have been the same. We would be funded at the same level we were this last year. which is great. However, we were supposed to go up the last few years to be able to fund some more programming. And I don't know that we're going to be at that level that we had been initially identified.
For our programs, we didn't see for the Older Americans Act, I can't speak for all of our bureaus, but we it was stayed at level funding for us. We went down a little bit in a couple areas, but nothing real significant. Because again, we're a minimally funded state, so we don't follow the traditional funding formula for the feds. But we're holding pretty steady. And when we talk to our either federal counterparts or our other states, when we all get together, especially with the new budget that will be coming up federally or continuing resolution, however that works out to be, our programs are holding pretty steady. I think everybody does know that there is a big need for this. We this is the boomer population is the biggest population, and in that age range. And obviously, I think the whole country is very much aware, like Kyla had said, or the silver tsunami. We're in it, and it'll go for a while. So everybody is very much aware of the needs of this, and it's only increasing for at least the next 10 to 20 years for sure. But our Older Americans Act programs have stayed pretty level funding. So we've been fortunate for that. And we also are in lieu to hopefully get another caregiving grant, which we're hoping to hear on soon. So.
Any other questions from the audience? You can put your question in the chat if you want to.
And we did all put our contact information in the chat if folks would prefer to shoot an email instead. So that's all there.
Well, seeing that there's no questions, we will go ahead and please, I guess everybody please help me thank the speakers and for taking the time out of their day to talk to us about these important topics and presenting to our program. Contact information is in the chat, so reach out to these guys if you have any questions. But other than that, thank you guys. Thank you, Melissa, Kyla, and Tessa. You guys did a wonderful job.
Thank you. Thank you for having
Thank
us.
you.
Thank you.
Take care.